do that. So first thing I wanted to say to everybody is thank you for joining us. It shows the dedication you have to learning about what is going on with your health and the fundamentals of health in functional medicine we're dealing with every day, right? This COVID-19 is just an extension of what we want to do when we're looking at balancing your thyroid, dealing with your autoimmune disease, managing your diabetes, dealing with your Crohn's disease, ulcerative colitis, whatever SIBO, whatever kind of issues you've got going on, the foundations are always going to be the same. And so, what we're going to do, I'm going to kind of talk about those foundations and some of the key things that we want to make sure we're doing, and then how that pertains to coronavirus and what we're currently experiencing, which is all very anxiety provoking for everybody, for sure. Okay, so first thing, functional medicine, the foundations, 5 pillars of health. You've got your diet, your exercise, and I'm getting a lot of background noise here. I'm not sure why that is. So I'm just going to see if I can quiet that because it's very disconcerting. So, okay, let's see if that works. So, and can everybody who sees me, can you raise your hand if you can see me so I know that I'm being heard? I don't see everybody, but let's see here. Let's see. Okay. Okay, I can only see a couple of you, and it looks like you are able to hear me, right? So if you can hear me, putting your hands up so I know. Perfect. Okay. So those the pillars of health are going to be your diet, your exercise, your sleep, how you manage your stress, right, and your community. And so those are really key things that we want to work no matter what the issue. And that's really what sets the terrain and makes the ground really healthy. We have a saying about our inner garden. And so that inner garden is what we're really working on making healthy. And the idea is that if you've got a very healthy inner garden or terrain, that the weeds can't grow there. And so when people come to me ill with whatever issues they've got, I view them kind of like weeds. So we want to pluck out the weeds, what don't we need, and then put in what we do need so that you've got a healthy grass, healthy ground, so those weeds don't grow. You want the flowers to grow, the trees, you want the plants that you are interested in, but you don't want those weeds. So good diet, lots of sleep, lots of movement for your body, good stress management, and there's lots of tools for that, and then a good community. And one of the best predictors of how well a person will do in their life with their health is the community around them. Those 5 people that are closest to you, how healthy are they? What things are they doing? And that's a really good predictor of your own health and your longevity. So kind of think about that as we're really cloistered in with this social distancing with the people that we live with. And so what things are those people doing? Could we mimic them if they're very healthy? If they're not so healthy, how can we move together to make them healthier? So as I'm going through this, if you can just contemplate those types of things. So I know COVID-19 is on everybody's mind, so I'm going to just start off with like 5 minutes of talking about that, and then we're going to go back to some of those pillars of health. So COVID-19 is the name for this virus, and it comes from coronavirus disease, COVID, and 19 because it was discovered in 2019. It is a virus that's called an RNA virus, and that means that it doesn't actually mean much to you guys, but to people that are trying to fight it, it helps them to figure out ways that they can hurt this guy, how they can stop it from being a problem for us. And one of the key things that everybody needs to understand that is important is how viruses are different from bacteria. So a bacteria is a single-celled organism. It can live on its own. It doesn't need us to live. It can use us, Sometimes it lives in us. Sometimes it's our friend, but bacteria can live on their own. Viruses cannot. They have just a little bit of RNA or DNA, and that's their genetic material. And then they've got the RNA viruses, and a lot of the DNA viruses have just a very small membrane around them. And it's called it's a lipo, it's a lipid layer. It's like a little fat layer. It's like grease around them that protects them. So that grease, that lipid layer, can be broken down. How do we break it down? Soap and water, right? That's why it seems like so futile in the face of all of this mayhem that's going on. But that's why soap and water is one of your best friends, because you can actually break down that lipid outside layer of that virus and you kill him, and then he can't do anything. So what's the viruses? Oh, I see Leslie has joined us. Yay.
I made it.
Yay,
Sorry.
you made it. So I've got everybody on mute and I'm just kind of talking to everybody. And then I told them that we are going to be doing a little question and answer at the end. But if they had any kind of urgent questions, they could just put their hand up or write it in the chat box and we'll watch the chat box. Okay?
Okay. Yeah.
So I was just talking about the virus and how the virus is just some DNA or RNA surrounded by this little fat layer that helps it to stay quote unquote alive. It's not really alive because it is not able to reproduce itself and it can't live outside of whatever its host is. So that's really important to understand. These viruses, what they do is they come into our bodies and they get into our cells. They have little, in that DNA, they have little codes for things that can help them get into our cells. And when they get into our cells, then they hijack our DNA. And they take our DNA and they use that to make more copies of themselves. And then they burst open that cell and they release all these copies and they go in and they infect other cells and they get coughed out or peed out or pooped out or whatever way they spread. And then they infect other people or animals. And when they're doing that, then they are, they're going to go into that animal, that host, take over their cells, make copies, and spread. So we can stop that just by simply washing our hands, right? Or by stopping it from getting into our body. So it gets in through our eyes, our nose, our mouth, right? These are the little taxi cabs as vectors to move them around. So we rub our eye, we pick our nose, we lick our finger, it tastes good, we bite our nails. Those are all ways that little virus will get in us and then start to cause the damage that it causes. But, if we can avoid that, if we can keep hands off of our face, if we can, wipe off the places that we're touching, and Lysol, hydrogen peroxide, alcohol, as well as soap and water, will all break down that little fat bilayer on the outside of it so that it dies and it can't get into us. So that's really important to understand that these simple measures are really key. Okay, so number one. Two, we spread it through our cough, and that's what we're understanding about COVID-19, is that it is spread through little droplets. Now, there was a big panic, and I do say panic, about this one report that came out that said it was spread through aerosolized ways. And that one study, they used this super strong nebulizer. So if you've got a child that's had asthma or you've ever had to use a nebulizer, they're not using that kind. They're using a big, big machine to force it out at great strengths, and then they see that it stays in the air. That does not mimic our everyday life with coughing and with walking. So that study has really no pertinence to our everyday life. All the studies that do look at things that mimic how we cough and how we can spread it in droplets don't show that it spreads through aerosolized manner. It's through droplets, which are bigger pieces. And they fall to the ground pretty quickly, but they can fall to counters. They can fall to shoes, to the floor. So they can fall and they sit on surfaces. And so we do know that it lasts on cardboard for, I think it's a half an hour, on steel and on other surfaces for several hours. So all we have to do is wipe them off every few hours. And we don't have to have Lysol. You don't have to go crazy trying to find Lysol in the stores. You can get some hydrogen peroxide. You can get soap and water. Just wipe off these surfaces regularly. So other people are using drinking alcohol, tequila, and stuff like that. So nice idea, but it's generally about 40% alcohol, and you really need 60 to 65% alcohol for it to kill it off. So drinking alcohol, nice idea, probably won't work as well as hydrogen peroxide, actual rubbing alcohol, or just good old soap and water. So those are some key things I want you to understand about viruses. Then moving on to kind of what it's doing. So in the States, we are doing some testing, but we're not doing, in my opinion, enough testing. We need to know who's healthy and who's not, because we see with COVID-19 that there are a lot of people that are walking around that are well, but they're carrying the virus. And so they don't know it. They're not trying to hurt anybody, but they are spreading it around because they're touching things, they're coughing, they're doing all the things we just talked about, and they don't have to be sick to spread it. And so they're with groups of people thinking that they're fine, they're not hurting anybody, and they may never find out that they were positive and the ones that spread it around, or they may get sick 2, 3, 5, 10, 14 days later. So our incubation period is, as far as we understand right now, from about 2 days to about 14 days. It probably is a little bit less, but that's kind of the range that they're giving us. And keep in mind, everything I tell you right now is subject to change, right? This is just what we know right now. And we're really in our infancy in understanding this because it is novel, it's new. So the incubation period is up to 2 weeks, and that's why we ask people to do the social isolation or distancing for 2 weeks. One sip. And that's why it's really key to kind of follow the recommendations right now, because in a perfect world, we would test everybody and we'd isolate just those people that were positive, right? And that way could keep all those people away and everybody else could go to work and do their thing. But that's not our world right now. So what we have to do is we're testing as many as we can. We're certainly testing those that we're not sure if they're sick with a regular flu, if they're sick with a cold, or if they're sick with COVID-19. So those people need to be tested, and first they should be tested for influenza and for strep throat and for all the usual players. And if those are negative, then they go on and get tested for COVID-19, because remember, common things are still common, right? If I get sick tomorrow, the most likely thing that I'm going to have is just your run-of-the-mill virus. Maybe the flu virus, but it's not going to be COVID-19. As much in our thoughts as that little virus is, there's way more influenza out there than there is COVID-19, and way more regular cold virus. So 9 times out of 10, if you're sick, unless you've been traveling or been near somebody that has had COVID-19, in which case your risk increases. But otherwise, your risk is going to be, it's just a normal thing. So I've got some friends, for example, their son was sick for about 5 days with a fever. I said, most likely flu, and it will probably break. And yes, sure enough, it broke, and he's doing fine. But as long as you are not sick, short of breath, can't breathe, high fever, having a seizure, chest pain, those are reasons to go to the hospital. But otherwise, most people that even most people that are sick, A, are not COVID-19, and B, if they do have COVID-19, they're going to get over it. More than 80% of the people are going to recuperate and be just fine. They're not going to need any kind of medical attention because it's just like a bad cold, if that, right? Many people don't even have that. They have no symptoms. So there is that 20% of people that are a bigger potential risk. And, even within that 20%, that can be children, that can be young adults, but they're much less likely. So it's possible, but it's not the people that are mostly dying from this. It's mostly people that are elderly or over 60. And I hate saying elderly over 60 because I'm right there. But the over 60 group is more at risk. and anybody with any underlying health issue that impacts your immune system. So that's your diabetes, your heart disease, um, high blood pressure, and we'll maybe talk about that at the end, why that might be an issue. Autoimmune diseases, people that are on cancer treatments, that are taking biologic things that suppress their immune system's ability to fight. Those are people that are higher risk, and they need to be very diligent about those things that we already talked about. But keep in mind that there's a lot of things we can't control, but there's a lot of things you have influence over. And so you have influence over your immune system. And you can do so much to make it stronger than it is, right? So don't smoke, don't eat junk food, avoid the sugar, make sure you're getting lots of fruits and vegetables, especially the high vitamin C containing fruits and vegetables. And those aren't just citrus fruits. And we can talk about that too. Make sure that you are getting plenty of sleep. Sleep is when your immune system heals. That, of anything, that's probably the most important thing to do, to try to get a good 8 hours of sleep and good quality sleep, right? You'll probably find, Leslie, maybe pipe in here. I'm finding that a lot of people, and myself included, are more tired than usual. Even though I'm getting my same number of hours of sleep, I'm waking up feeling not as rested as I usually am. Have you noticed that? Sorry, you're still muted here. Let me see. There, is that
If
better?
people, can you hear me now?
Yeah, I hear you now.
Yeah. I think if people try to stay a little bit adherent to their regular schedule, I think some people are experiencing a little bit of a shift in circadian rhythm if they've changed, if they're sleeping in, if they're going to bed later. There's definitely an impact to that. I told people right away, the best thing to do is kind of stay within your routine and kind of keep things in as best order as you can, even though you're not necessarily waking up and having somewhere to run off to. But it's still really important to keep that same routine for your own, not just your energy management, but getting that vitamin D, getting that sunlight in the morning, going to bed at a normal hour and getting the quality hours before midnight, which is really important for some of the most, restorative type things that our brain's doing. It's happening before midnight. So, I have heard that. I think there's a little bit of, I think the mood that might be something, is just the kind of what's in the air, and people are trying really hard to stay positive and trying to get through each day. But I think that it can be a little bit, maybe fatigue, but it's a little bit discouraging for some people too. So trying to stay in that positive mindset is, I think, pulling people back a little bit.
Yeah, no, it is no question. It's hard. I just find that everybody's anxiety level went from here to here, right?
Yeah.
It's big and understandable, right? This is a major thing, but that anxiety isn't helping us, right? So things that you can do to bring your anxiety down. Remember, stress management, one of those pillars of health. So whenever we're stressed, we're in that fight or flight mode. Our immune system is being damaged.
Yeah. I
So,
heard a podcast this morning with Dr. Mark Hyman, and he was interviewing a guy, but he brought up a study they did on viruses, where they actually put swabs of a virus in people's noses,
mhm,
and the people that had reportedly higher stress contracted the virus, whereas the people who didn't did not contract the virus.
yeah,
So it was a really powerful study, and right in line with what we're talking about, how important it is to kind of manage that stress and the cortisol to kind of keep your body in that parasympathetic state, or at least encourage it. We have an opportunity here
mhm,
to work harder on that parasympathetic state. We have, some people are dealing with, either the time off from a job, or they might be working and they're in such a state of gratitude, or should be,
yeah.
that they're able to kind of work through some of the exercises and the tools that we're constantly preaching.
Right. It's huge. And this is one of those things, I'm always trying to make lemonade out of lemons, right? And so it's a lousy situation. But because people are at home more, they're not commuting to work, they're not spending hours in their car, maybe they're not working at all, they have more time to exercise, more time to cook those meals, right? There's more time to do all the things that I talk about day in, day out that help you to be healthier. So our self-imposed social distancing isolation is actually a benefit in terms of, if we choose to, of course, to improving our immune system and really helping to boost those things that we said we didn't have time for before. And now we really have no excuses other than those shift workers who are working 12 on, 12 off, those guys I'm going to cut some slack to.
Yes, exactly. I'm sorry.
That's
I have
okay.
a hungry little boy here.
You got some
Um,
community there.
yeah, and I think to just reiterate some of the importance of sleep, like that we're talking about it in everyday life, right? We're exaggerating it here and the need for it here, but this is something we talk about in functional medicine all of the time. It's like in the top ranks of the wellness, what we need to maintain wellness. And I think people, to me, sleep is like the magic time for our bodies to do what they need to do, our brains to clean themselves. Like there's so many critical things that happen during sleep
Hmm.
that I think people, when we go into the Q&A, I think we should dive a little bit deeper into that, so that we can kind of just reiterate the thing with this situation is I think the biggest thing I'm hearing is people are staying up later.
Yep.
So with that usually comes getting up either later or just being groggy the next day because they're not exercising as much because they're not getting up and going, and that's causing them to not be quite as sleepy at night. Exercise improves your sleep.
Yep.
So, but just to make sure they understand like the impact and the power of what sleep's doing every day, and it's more critical during this time, just like stress management is.
Yep. Yep. All of these pillars are critical at all times. And, Leslie and I are always talking to people about this. So we're really happy that people are suddenly very excited about it, right? But we shouldn't have to have a crisis like this to be paying attention to what we need to do, because
Yeah.
these are things that are going to really help us have a longer lifespan or health span so that um, we can be healthier for longer. Um, so these are things that you want to work on all the time, right? So, but particularly important now. But once this all is over, don't go back to your regular, lives and stop doing all this stuff. Really try to notice what things are helping and create those daily habits. Okay? Yeah. And what you're going to say something else?
No, I with regard to sleep, not so much. I think I'd be happy to kind of tap into a little bit of the exercise stuff
Yeah.
because I've never in my life seen so many people online live exercising. Everyone from the studio I work at where I do the Pilates, every single one of the individual instructors have offered live free classes online. Like there's absolutely the least amount, there's no excuse to
Right.
not be doing some sort of movement and activity, especially right now. The accessibility and the free, like wonderful content and the awesome workouts that are out there are just unbelievable. Like I'm doing more now physically than I was doing every day of my normal life.
Yeah.
Because there's just so much. I'm forced to kind of get creative, and I'm forced to do some stuff at home, and I'm trying things that I wouldn't normally do. So
Mhm.
it's been really really powerful for me individually. There's everyone with different levels of movement capability in this group, and if it's going out for a walk or if it's sitting out in the sunshine and doing your breathing and things like that, this is just the best time to start taking those tools out of the toolbox and start implementing and making them habits. You probably have more than 21 days to make these things stick, right?
We probably do. So the next thing, so we talked a little bit about exercise. Let's talk a little bit about stress, like other things that they can specifically do to like some of the different tools. So exercise is obviously a really good stress management tool, but um, some meditations, like what are some of the things you're suggesting to people to do for their stress?
So for stress management, I usually look at multiple things within that, right? So the top of that would be that just simple breathing. So practicing simple breathing exercises. Um, Gratitude is really, really, really important. And these are the best times to find that gratitude practice because you have to kind of dig deep sometimes and look for things, like go out of your way to find like the little golden nuggets of like things that are in the everyday mundane stuff, right? Before we had our routine and it was easy to kind of go through the day and not see some of the greatness, but now we're in a place where we have to make every little moment extraordinary. It's up to us, right?
Right.
Otherwise, we can sit here and be pouty and grumpy and how are we going to get through this and all this stuff. We have an option and we have a choice into how we perceive this experience and what we do with it. So our effort being that we have the time to do a little more breathing, we have the time to put a little bit more into our healing practices. So gratitude journaling, I would say I like to do that still in the evening time because I like to reflect back on the day. And the breathing, meditation. I'm a huge fan of guided meditations. I do a lot of the podcast Tune Into You and the meditation minis, which I share with most of our clients. And then, of course, there's tons of, if anyone's a Peloton rider, you've got a ton of people that are buying these Peloton bikes. They have a whole meditation, yoga, stretching, a plethora of offerings on there. And again, another thing that people are offering live. I have a girl that does an amazing, I mean, just so I would just lay there to listen to her words, forget, doing the stretch part. That is just so incredibly powerful with some of the inspiring words she says. So find like a really good resource like that and pal up with friends, hey, we're going to do the meditation tonight, let's do it together and then talk about it.
Yep.
There's
And another thing somebody's mentioning is there's a TED Talk called "How to Make Stress Your Friend" by Kelly McGonigal. And so um, check that out. "How to Make Stress Your Friend" by Kelly McGonigal.
Yeah, I mean, we're in a position here where we have the opportunity to embrace it and to kind of like, you know, live in the moment. We've got to start being present. We're in a really deep place of uncertainty, and human brains just do not like the thought of uncertainty. And our brain will take us in all different directions if we let it. So finding comfort in the uncomfortable is the challenge, and that this is the time to practice it. We're practicing it every single day.
Right. The universe is giving us good opportunities. So that's something to be grateful for, right? And instead of meaning this, like now we're grateful for toilet paper, right? Who knew? Right?
Who knew?
Who knew that was going to be a thing? I'm grateful for all the funny memes I see. Like there's humor just exploding, all over the place. So there's so much creativity that I'm really, grateful to kind of be part of that. So there's a lot of things that I can be grateful for, even in the midst of all these dire things that are going on.
Yeah, and to be able to celebrate and find joy in this time is not discrediting tragedy. I mean, the thing is that we're all very empathetic beings. And when we watch the news, which that's I really want to dive into the amount of consumption that
Yes.
you're watching because your brain doesn't know the difference between imagined and real. And all of us are human. You watch something and you see a sentimental story or a tragic story, and you're immediately, oh, what if that was me? What if that was my family? How did that, you're taking
Yep.
in that experience as your own. You're imagining what it feels like. Your brain doesn't know the difference. And it's very, very stressful for you to take that experience on as your own. And that's people have to learn to form kind of a boundary around themselves and be able to consume what they need to keep themselves responsible and keep them at low risk. But there's no reason. It's like, let's count the number of cases of people who have recovered from this, not the number of death toll.
Hmm.
Like if you stare at the news, I can't even watch it for 5 minutes. It's so anxiety provoking. It's terrible for your body. It's terrible for your mind.
And it's
Focus
not
on the
helping you.
funny, the
Not
comedy,
it's not helping you. You're going to
doing
do the
nothing.
same thing that we've just talked about. How
Yes,
many people died is not going to make any difference to what you're going to do day in, day out, because you're not going to be one of those people if you're practicing all of these things. And so it's I understand why people almost gravitate to it because of the horror of
yes,
it, but it's not helping anybody, and it increases your stress and makes you less likely to be able to deal with it in the long run. Um,
exactly. I
yeah.
mean, find your one resource. I have a friend who's pretty, she gives me little bleeps and she knows that I don't like to take in too much. So she keeps me updated. But like for the most part, just just get what you need to make yourself feel comfortable and confident that you're educated on what's happening and then let
And
it go. The
let
the
it go.
humor is amazing.
Yeah.
The humorous memes and the things that coronavirus or otherwise, finding things that make you laugh and bring you joy.
Right. Absolutely. And don't confine it just to TV because a lot of people are just like Netflixing for like 8 hours a day. So
Yeah,
find books, go for walks, right? There's just so much to do. Don't just be a couch potato and sit on the couch. Make sure that you're expanding, what you have the opportunity to do. Do some more cooking. Maybe you do some gardening. Maybe you're out walking a dog with a friend. I mean, there's just lots that we can do so we're not just sitting and watching movies all day long. Not that movies
Yeah,
are bad, I
and
like them, but still.
yeah, and this is the thing. In a month from now or however long it's going to take, I guarantee you people are going to look back and go, what did I do with that time? And like this time, just like any other time in our lives, is a time that every single moment that we experience becomes a memory. And you can choose what these memories are going to be for yourself. Are they going to be joyous memories? Are they going to be stressed and worried memories? Are they going to be things that you can take forward and say, this is what I learned from? What was the opportunity here? We're managers of our mind. We have to decide what we're going to allow in our minds. If we were like a business owner and we're telling our mind what to do, if we've got, we might have a supervisor, we might have a guy in there that's cleaning up our negative nasty thoughts. We have to control some of the things that are going on in there, because your brain only knows the constant data. It's that repetitive data, which is mostly negative. It just statistically mostly negative.
Right, for sure. Last thing, and then let's talk a bit about food. So community was the other pillar. And then I want to dive into food a little bit because I think that's important. So community, really key at all times, but really key now and ever so much more challenging because we can't get in there and physically, like, we want to hug people.
I
We're people that want to do that, and we can't do that now. And so the closeness that you want is dangerous for those that you love. So it is very challenging, but we have
Thank
these
goodness for dogs.
wonderful tools. Hmm?
I
Thank
said,
goodness for
thank goodness for
dogs.
dogs.
Yes, for
No,
sure.
but I've never had more fun with FaceTime. I never FaceTime. I'm not really, but my girlfriends now, we plan our little afternoon calls and we try to get together as a team, a group of us, and then we're planning to have coffee over Zoom. Over the next few days, we're trying to figure out how to set that up. Of course, we're not tech savvy that way either, so as you can tell. Um, so I think using some of the social media, options, and then even just phone calls, calling family. This is a great excuse to check in on people.
Yep.
Hey, I'm thinking about you. Who are you thinking about? I've had more people come to mind during this time that made me actually take action and reach out versus just thinking of them and letting the moment pass.
Hmm. Right. And one of the other people watching tonight says there's a website called Inspire, or sorry, Inspire More. So it's all positive news. So that's a good one. And
Yeah,
actually,
there's John Krasinski, the actor from The Office and from Jack Ryan. He started up. It's called. I just saw it. I'll have to post it if I can find it. I'll post it in the feed. It's like a positive news only type thing,
hmm,
and he posts all these real cool inspirational stories. It was really cute, and he got on. It was just a clip I watched, but he's gonna keep doing it and keep adding in more and more inspiration. So I'll try to find that.
yeah, so those are good things. And then let's talk a little bit about food, and then I've got a few questions that I'll answer that people have been putting here, and we'll open it up to other questions. So food, as usual. So we want to have a plant dense, very nutrient meal, right? We don't want to be eating junk food now. This is not the time for nachos and chips. This is the time for really giving your body, that Maserati body, the fuel that it needs. And so it's really important that you don't dive into all the Twinkies and all the rest of that good stuff that's out there. Um, really look for your plants, your nuts, your seeds, your hormone-free animal proteins, and try to kind of not be so heavy on the carb side unless it's the complex carbs, which are your veggies, your fruits, that type of thing. And specifically, the vegetables and fruits with lots of vitamin C, lots of zinc, are going to be your nuts and your seeds for zinc. Um, and for the vitamin C, we always think citrus, but there's tomatoes, there's papaya, there's kiwi. There's a lot of other foods that are really high in vitamin C. And then if you're not eating those, or even if you do eat them and you want to augment, you can use some supplements with higher dose vitamin C and some zinc and some lysine, which has shown to have some benefit with other viruses. Obviously, we've never tested any of these things on coronavirus. But you can just do those things that help to support and make for a strong immune system. Anything else to add
Yeah,
there?
any type of anti-inflammatory immune boosting foods.
Yeah.
So
Right.
your greens. your leafy greens, things like that. If you have any digestive, I would suggest doing a little bit more of the supplementation, ensure that your body's absorbing properly. But um, I'm loving going back to the good old playing around with recipes,
Mhm.
you know.
And I've got
From
a group chat that I'm doing where we're all sharing recipes. So
Oh,
because
that's
everybody's
cool.
getting tired of like you're now feeding you whatever your group of people is 3 meals a day, right?
Yeah.
So it gets tiring pretty quickly. So do that with a group of friends. Share your best recipes. And the interesting I've noticed is that in the grocery stores, the outside of the grocery store, other than the meat section, is not being,
Uh,
depleted, right? It's the inside and it's the meats, all the packaged stuff and the meats that are gone. And maybe the eggs for a little while, but not so
I
much
noticed
lately.
that too.
Yeah. So your fruits and your veggies and the nuts and the seeds, lots of those. So if you want to do some cooking,
Yeah.
there's plenty of opportunity.
Yeah, I noticed the same thing that, the stuff that's kind of people would typically hoard for hurricanes and stuff. They're, wiping potato chips and tuna off the shelves. I'm like, we're in a position where we do have water. We do have, things that are accessible to us so we can
Yeah,
really actually use there's just I think that the universe is sending a very personal message to every single individual in a different way. So I think everybody is taking this message as what do I need in my life? What am I trying to learn from this? And if you really look at it that way, like what am I meant to create? What am I supposed to get better at?
mhm,
What opportunity is here for me while this is happening? We can flip the script on what's really going on.
100%. Yep. Right. And I think Mother Nature is, so I saw me, Mother Nature sending you to your room, right? So
Yeah,
we needed, I think, my view is as a race to kind of get back to centered, right? With being with our families and cooking and sleeping and kind of being in tune with
definitely.
ourselves and around us and look at the rivers in Italy, right? They're cleaning up. They suddenly the satellites, the space station can see China, right? The pollution is going down. So we have done more to help global warming and to help heal the earth in the last few weeks than we've done with all of our talks and summits and the rest of that. So there's
See, there
I,
are
I don't want anybody to
great
die from this, but don't get me wrong, I would never wish this on anybody. But we've got to look for the positive that's coming out of it and learn from that. What do we need to be doing?
And we need to watch the prediction of outcomes. We're all anticipating what's next. What's next? What's going to happen with the economy? What's going to happen here? And when we're in a constant state of predicting outcomes, that's again that's the catastrophic thinking. That's the working messing with your brain to where you just can't see what's going to happen tomorrow. And all the scenarios that you put your mind and your body through, they're just you can't 90%, 99% of what you're anticipating isn't going to happen anyway. We
Mhm.
have to just take this in as it goes live.
Right, right. And we'll be able to manage it. We don't have to have like a plan for every scenario because whatever actually happens is not going to be one of those scenarios that we've been thinking about. And we will manage it just fine like we always have, right?
Yeah.
Just stay strong, be centered, make sure that you're doing the best you can to stay as healthy as you can, and then you're just going to move forward from there, right? As a race, and we've got just keep your community around you. That's what's going to really help. Um,
Yes.
so I want to answer a few of these questions, and I'm going to open it up to everybody's questions. So recommended doses of zinc, vitamin C, and lysine. So zinc, generally you want to take about depends on your stomach, but between about 40 and 50 milligrams a day. Start off with 25 if you've got a queasy stomach because it can make you nauseous, and always take it with food. But in the bioimmunozyme, I think there's about 40 milligrams. And so I'm suggesting that for everybody, at least one a day. And you can take zinc separately, and of course, zinc containing foods. So you want to do that. Vitamin C, generally, we're using about 2.5 grams to 3 grams of vitamin C a day. Most of your pills are going to be anywhere from 300 to 500 milligrams. So that's 2.5 grams is 2,500 milligrams. So you benefit from a high dose. In some people, though, it can give you a little bit of loose stool, so you have to watch that. We are also using vitamin C in IVs, and they've been doing that in New York, and they were doing that in China to treat it. So we don't know how well it prevents it, But if it's useful treating it, then maybe it's useful in preventing it. And certainly we know vitamin C has got a lot of benefits for your immune system. So you can do it IV,
Yeah.
you can do it oral, and do it in your food for sure. 100% do it in your food. Lysine can also, depending on what you've got, but anywhere from 50 milligrams to 100 milligrams of lysine daily is generally going to be good enough. And then I also like olive leaf, and that just comes as a capsule. And I use the Designs for Health one. I don't know exactly the amount of milligrams that's in that, but generally one capsule if I'm just trying to kind of play it safe. If I'm treating somebody with a kind of infection, I'm generally going to use two twice a day, um, and that's in coordination with everything else we do. Right? It's nothing. None of this is going to work by itself. You need the sleep,
Yeah.
you need the stress management, you need all of it.
And like we were talking about earlier, it's the principles of wellness. It's the pillars. It's the things that we're teaching in functional medicine every day. So we're never going to stop talking about sleep. We're never going to stop. These are just kind of the old school things that suddenly just
Work.
became like, why are these important? These little tiny things that add up to really big things. I think sometimes people disregard the power of
Because they're
the
so common.
simplistic,
Yeah.
the simple things,
Hmm.
So if you're continually doing these simple things and staying consistent with these simple things, you are 90% better off than the next person who's not.
Right. Absolutely. And I just go back to the washing your hands. So the guy that discovered that washing your hands was important was a doctor that saw that women that went to the hospital to have their babies, this is back in the 17, 1800s, 1800s.
I'll remember this.
Yeah, so they would go to the hospital, almost 90% of them would die. If they had their birth at home with a midwife, 90% of them would live, right? And so they didn't figure it out until they realized that the doctors were going from the morgue where they were doing autopsies on people and then going to deliver these women. And of course, they didn't have gloves at that time and they didn't know about washing hands. So they would go there with their bloody hands and deliver these women and bring all these microbes right to the women and kill them. They didn't mean to, but that killed them. So just the simple act of washing their hands after going to the morgue, again, didn't have gloves, they just washed their hands, death rate plummeted. So
Yeah.
so it's huge. And the guy that discovered this got laughed out of town. In fact, he ended up in a mental institution because he was so made fun of for that. But once they finally started doing it, they went, "Oh yeah, you were right."
Always, right?
Yeah, right? So washing hands, really powerful. Somebody asked, do we have to wash the floors every few hours? No, we don't, because we're not crawling around on it. But if you've got babies crawling around on it, make sure people take their shoes off, leave them, at the back door or outside, so you're not bringing in all that stuff. And maybe you're in socks, or maybe you have something over your foot so that you're not bringing anything into the house. And then you wash it once a day, once every other day. Then you're not bringing a whole bunch of stuff in. Right? So
Yeah.
you don't have to wash the floors every couple hours. It's keep the shoes out there because they're not only bringing in viruses, but they're bringing in your pesticides, your herbicides, all the chemicals we throw on our lawns, all the stuff that's out there, we're bringing in on our shoes.
Hmm.
So that piece is simple. Then somebody else asked about a molecular versus serologic testing. So what does that mean? So right now they're working or they've got tests that will look to see if you have the virus in you. So called a PCR test, which is looking for the DNA of the virus. It doesn't know that the virus is able to actively use its DNA to go in and infect a cell, but that virus is there. So that's looking for the actual um, being of that virus in that person, whether in their nose swab or their throat. And that's what we're using to look for disease. But there are tests to see if you've been exposed to it in the past or currently. So there's immunoglobulin levels that you can look at. And our body first makes immunoglobulin M as a acute response to an infection. And then after it's been there for a little while, it makes IgG, immunoglobulin G. So you can look at those titers and see, you do one now, and then you repeat it in a little while, and then that can help you to see if um, if you were going through it or if you've got immunity. So they are working on those tests, but we can't use those immunoglobulin tests to say that you've got it or that you don't have it or that you are resistant to it. We can't say that at this point. Um, so I know that they will be trying to do that. They're going to be definitely doing some population studies after this to see who had symptoms from it and who's got what looks like immunity to it, because they've got the IgM and the IgG. That generally confers immunity, um, but we don't know yet. So we're looking at two different kinds of tests. So anybody right now that's offering the immunoglobulin test, it's not FDA approved yet. So we don't know how sensitive or specific it is, but it will be coming. But you just can't use it as a diagnostic tool. I hope that answered that question.
So that's that would be comparative to, like, say, Epstein-Barr virus you had in your body when you were young. Those are the measurements that
Right,
we can tell whether it's been dormant or if it's active or if it's something that you've had in the past and not, correct?
right, exactly. So if you had mono as a teenager, then you'll have um, immunoglobulins to it, IgG and IgM both. And so we can see the titers and we can see it looks like you're immune. If you've never had it, you won't have those antibodies in there. So it's exactly like that.
Okay.
Yeah. So I'm going to unmute everybody. See if we've got a cacophony here. But does anybody have any other questions they want to ask?
You can raise a hand also if they have
Yeah. And you can write it in there too if you want.
yeah, when you unmute, it gets real loud. So I would
Yeah,
maybe have them raise their hand and then
I'm
you
going
can
to do
turn
that.
just them on.
Yeah, I'm going to do that.
I've got a question.
Oh, sorry, I just hear. Uh, sorry, who said I've got a
Hi,
question?
it's Blair. It's me, Blair.
Okay.
I'm a flight attendant
Mm-hmm.
and I'm working a few times a week on the plane, and we're wearing gloves and we're cleaning down the items, the serving items in the galleys. Is it really important for us to wear face masks? It really kind of scares the passengers, but is this important for us to do?
Okay, and I'm just going to mute you while I answer just because there's a lot of background noise, okay? Um, so, um, other than, let's see. So that's a tough question because you're in pretty close quarters there. And when you lean down because you can't hear somebody and they're asking for something, and you've got three people that you're leaning over to hear the guy that's near the window, you're getting yourself really close to that person. And that's too close. That's less than your 6 feet and certainly less than 3 feet even. So I think in those situations when you're doing food service, for sure, a mask would be useful. Um, do you have to wear an N95? That that there's differing opinions on that, whether that's really helpful or not, or whether just the regular surgical mask. The surgical mask is not going to protect you from breathing everything in. But if somebody that's in the middle row coughs while you're talking to somebody that's in the window row, that's going to help you because you're not going to breathe that right in. Um, so in an ideal situation, to be extra careful, probably the N95 would be ideal when you're doing food service. I know a lot of planes right now. I've got some other patients that are flight attendants, and they have stopped a lot of food service other than on the long flights. And I think that's probably, as a flyer, I don't like that, but as somebody who watches out for the flight attendants, I think that's a good idea. But if you're just walking up and down to see how things are going, I don't know that you necessarily need that. Does that answer your question? And let me just see if I can find, that was Lara. I've got a whole bunch of people that just show up as caller.
That was Susan Blair, I think.
Oh, is that Susan? Okay, I don't see. Oh, here we are. So Susan, does that Blair, does that answer your question?
Yes, it does. It does help. Normally on a flight, we have less than 20 people on the plane, and they're all socially distancing. So that tells me that I can get away without wearing the mask.
Mm-hmm.
And we don't serve food. We now just give a bottle of water and a closed snack. So there isn't a lot of interaction with people on purpose.
Yeah.
And so that helps a lot.
Yeah. Yeah. I think you should be fine. But uh, gloves, definitely when you're doing the trash, when you're doing any cleanup, 100%. And
Hmm.
just wash hands. And when you go home, I would just strip down at the door and wash everything, shoes off, and then shower because
Okay.
who knows what you've got on you. I do that when I worked in the ER. That's what I would do after a shift just because I just don't want to bring that stuff home to my kids. So I just don't want to have anything on my clothes. And I just do the same thing. It might be overkill, but it's an easy
Got
overkill.
it.
Yeah.
I'm good with that. Thank you.
Yeah, you're very welcome.
So there's a
Uh,
couple more questions in the chat.
yeah, so I see that Leslie has a dog, as do I. Anything we should do about walking our dog?
Great question.
They walk outside, then in our house. A friend of mine bought doggy socks for outside. Is that really necessary? That's a tough one. I don't know that it's so necessary, but I guess maybe if you got small kids, it might be a worthwhile thing to do because it is going to be their feet, and their feet do run through the grass and bring in the pesticides and the herbicides. I'm probably more worried about the chemicals on your neighbor's lawn than I am about COVID, but I think they're kind of one and the same right now. So might be worthwhile, or if you can just wipe their paws off as they come in, depending on how easy they let you do that, that might be helpful. But we want to just try, if you've got little ones, we want to keep the floors clean. If you're a grown up and that's your dog, it just depends on how close they are. You can see Leslie's dog is all over her.
Mine's climbing on my face. So
So I hope you're
that's a
wiping
great question.
her little paws off. But yeah, otherwise you're okay. And somebody else says, my boyfriend who lives with me has a dry cough for about 2 weeks. No other symptoms. He coughs mostly into his elbow, socially distancing, but he does have free reign of the house. Should he be isolated in a single room and or sleep in a single bed? That's also a tough call. If you're somebody with diabetes or on a biologic like Humira and something like that, then you probably do want to socially isolate. If you're not and you've been with them those 2 weeks, I don't know that it's going to all of a sudden make a difference now to do it because you've been together for 2 weeks. If he's got it, you've been exposed. I can tell you though that not everybody that's exposed gets it, right? There's been all kinds of reports. There was one case that was reported where 41 people, 41 healthcare workers were exposed to somebody they did not know had COVID-19. They had pneumonia. They had to intubate them. And so there was 41 people around them and when you intubate, you guys don't know this, but when you intubate, droplets go everywhere, right? There's just stuff that's going and you're trying to get IVs in and there's lots of stuff that's going down. So all of these 41 people have been followed and nobody has gotten positive. Now they just had regular surgical masks, not the N95, and they had regular gloves. So they're practicing good hospital technique. So it doesn't mean just because somebody was spewing on you that you will get it for sure. Another person in nursing home, and the nursing home patient passed, but all the people that were around her as she passed didn't at that point realize exactly what it was. They've watched them 30 people, and they haven't got it. But then there's other people that seem to be super spreaders. So there's other people where one person's got it and spread it to 20. So I don't know. Maybe those 20 were eating Doritos and not sleeping and, staying up all night and watching scary movies where their cortisol levels were really high. I really don't know. But there are things that you can do. And so it's not a fait accompli if you're exposed to somebody with it. Okay. And should he wear a mask? Um, Probably not a bad idea, just even a surgical mask or a bandana, just something so that it's not kind of going out all over the place. And he needs to be washing his hands well, and so do you, and wipe down surfaces. Just kind of go over them every couple of hours wherever they've been would be a good plan. Let's see what else here. Somebody asked about adding vitamin D to their, yes. Everybody that sees me is on vitamin D. So if you're not, then we need to get you on it because that's one of the first things I put everybody on. So vitamin D is super important for your immune system. Um, yes, so definitely get on it and get the sun. Get your natural form of vitamin D. Get outside and exercise outside. Do yoga outside. Meditate outside. But we in South Florida have no reason to not be out there, and we haven't had rain, so
Oh my gosh, we have had incredible weather. I'm like every day I'm like, talk about making memories. It is incredible outside.
yeah. And so Karen here has a question. I'm just unmuting her. Hey, Karen, did you have a question?
Oh, no, I already asked it. It was about the
Oh,
dogs.
oh, okay. Sorry, I just saw your hand there.
Oh,
Okay,
sorry. Thanks.
no worries. I see Barb has a question here. So, Barb, you had a question?
Oh, no, thank you.
Okay. So, let's see if anybody
I
else.
have a question.
Okay, sure, shoot.
Can you hear me?
Yeah, I
Hi,
can
I'm
actually.
Princess. So at work, I'm noticing there are a few people that keep checking their temperature and they have this low-grade fever but no other symptoms. One of them decided to take a leave of absence, but the other one, she's just been taking Tylenol, and she says she's fine. In a situation like that, should we encourage her to probably wear a mask?
You should encourage her to be at home. If she's got even a low grade temperature, it may just be
Uh-huh.
regular run of the mill virus, but we don't know. So I'm glad she doesn't have any other
Okay.
symptoms, but I think it would probably be in her best interest and in everybody else's just to go home and then kind of see how
Right.
she is. And then once the fever is gone, then she'd probably find a return to work. If for whatever reason she's not willing to do that or her boss isn't willing to tell her to do that, then a mask, yeah. And I'd stay away
Okay.
just because you don't know. You really don't know. A lot of people are these um, healthy carriers that they might just have a low grade temperature. And again, it could be regular rhinovirus, but it might not be.
Okay. Thank you.
Yep. No worries. Let's see. Anybody else here? Let's see if anybody's typed in any other questions. And I think we've answered most of them.
I think
Oh, actually, there was one here. What will use of antibiotic wipes have the potential to have a negative effect on causing an increase in antibiotic resistance? It can. So it depends on. I'm not sure if you're talking about like the wipes that have got the triclosan in it, or which wipes. I don't think that there's really wipes with like doxycycline or any antibiotic in it. But I think it's more the other ones, and it could have. We're going to see a lot of ramifications from a lot of the things that we're doing now that we don't totally know. But we just need to do the best we can in this particular situation. And so if you can use soap and water instead of them, even better. Anything to add to that, Leslie?
no, I'm on it with that. I was looking at Susan's question just came in about the mask again. But yeah, I tend to agree. There's probably going to be some ramifications. I've never used so much, and antibacterial. I've kind of trained myself to stay as much. I'm trying to stick with the hand washing as much as I can.
Yeah, exactly. Hand washing is really key.
Moisturizing.
Yeah, and moisturizing for sure. Yeah, and really you do want to moisturize because when you're washing your hands a whole bunch, that creates dryness, and then there's little micro injuries, and that's where those bacteria can get in, cause infection or viruses. So viruses don't really go through skin very well, not well at all. In fact, it's going to be
Cracks get better, right?
cracks the skin. Yeah, but the mucosa is really where they get in. So a 190, N95 mask. Use it on the plane. Somebody's asking if they can use their N95 mask that they used at home on the plane. They probably could. You just want to watch and make sure that it's kind of got a tight seal around there because if you've used it a lot, it may start to break down. And we again don't know how often you can use these N95 masks. We used to always think of them as being single use, one patient, throw it away. But now with the shortage, we're using it longer. I think it's probably okay, but we don't know 100%. So probably better than nothing if you're in a sticky situation. And then is a mix of water and vinegar enough cleaning solution? Probably not if it's really a surface you're concerned about. I would try to use the just good old soap and water. You can throw some vinegar into that to make it even better. But soap has this thing that breaks up the fat little globules that are protecting him. And the vinegar will too, a little bit, but most vinegar is pretty watered down. So I think you're probably better off with the soap water and maybe a little combination. And again, not a lot of research on it. So what I say right now, I might find out something new in 2 days and I'll try to update you. Okay, guys. Well, thank you very much. If there's any more questions, we're happy to answer. But if not, stay safe, stay sane, eat that nutrient-dense diet, get your exercise, get outside, get in the sun, do your stress management, connect with friends and family, and really just try to find your lemonade in all of this. Like Leslie said, I love that statement. What is the thing that the universe is talking to you about? What do you need to do differently? What can you work on? How can you find a gain out of this? How can you find a benefit? Right? Because
Really quick, I'd love to add with
yep,
the sleep. A lot of people are expressing the concern that when they're home, there's some stress eating, there's bored eating, there's a lot of emotional eating going on. The sleep is really, really important to control your hunger hormones. And if you're not getting good sleep, you're waking up and you might have like a complete insatiable need to like, go after these cravings. So sleep is going to help with that need to feel like you have to be eating because it's going to control the leptin hormone, which is the hormone that tells your body you're full.
very
So
good point.
your poor sleep can turn off that leptin hormone. You can wake up the next day as their blood sugar can be as representative of someone with prediabetes as far as your insulin resistance. So you really want to make sure that you're getting that sleep so that you can get your hormones in balance. And then of course when you're feeling some of those emotional eating triggers and prongs, is noticing what the triggers are and then start to kind of change some of the behaviors around what's causing you. Like if you notice TV is causing you to bring that bowl over, you might want to switch where you're watching TV or the time of day that you're watching TV, but switching up that habit loop that causes the eating to begin with when you're really not hungry.
Yep. Get up, go for a walk, find something funny to read or watch, just switching it up.
And even just asking yourself, does my body need fuel?
Yeah.
Sometimes people are just eating because when they're not hungry. So really just tap into, do I need fuel right now? I ate an hour ago. Am I really hungry?
Right. Or am I
Be
stressed? Or
mindful
am I
of that.
sad? Yeah. Or am I
Yeah.
missing somebody? Yeah. Or am I
Yeah. Am I
scared?
feeling a void?
Yeah.
Yeah.
Right. And then if you're scared, reach out to somebody that can help you. If you're lonely, those are kind of reasons. If you just kind of feel really unfocused and you feel like, oh, I need to really center myself, do a meditation, go for a walk,
Yeah.
right? So there's all kinds of reasons for going for that chocolate bar or the stress eating.
Yeah. Yeah. We're here for you guys if you need anything.
100%. Yep. My job is to keep you guys all healthy. I'm going to do a survey at the end of this and see how many people ended up having symptomatic COVID-19, because I won't know how many actually had it, but see how many people were symptomatic and got tested and were positive. And we're going to look at that data to see just how well this is working, because over time and in other epidemics and things like that, this addressing that foundation, that terrain, is what really makes the difference. There's your pooch, and that makes a difference too.
Oh, I can't see him in my picture.
Okay. Anyway,
he's like dinner.
Yeah, dinner. He's ready to eat. Yeah. So thank you guys. Thanks everybody. Sending you big warm hugs and stay safe. And we will connect whenever we connect. We'll probably try to do another one of these in a couple weeks rather than a month, just to see if there's any other questions out there. Okay?
Yeah. It's a critical time, guys. We're here for you.
Yep, we got it. Okay, take care, guys. Tuning
Thanks.
out. Night, night. Going to get some dinner now.